Hello everyone. Today we're here with Valerie and Heather, and we're doing an informational summit on brachymetatarsia. Valerie, we're just wondering if you could just let us know a little bit of your journey, how you got here to Paley Institute and to our common denominator, and that's Dr. Lamm.
So my journey with Dr. Lamm began because of really social media. I had been doing some research about brachymetatarsia, trying to figure out what treatment option I should choose, what surgeon I should choose, and I went on multiple consultations, talking to different doctors, and I just was not satisfied with the information that I was receiving. So I got on a Facebook group and I was kind of venting, to be honest, about how unsatisfied I was and how disappointed I was. And someone said, "You ought to see my doctor. My doctor was Dr. Bradley Lamm. He was amazing. You would not have these issues with him. You would get the information that you need. You would feel comfortable moving forward." So I got the information from her, and she was exactly right. Dr. Lamm was exactly what I needed to fix brachymetatarsia, and I honestly do not believe I would have gotten the results if I had chosen to go with someone else.
My story is a little different than Val's story. So I found Paley and Dr. Lamm through social media. But I found him out of a need, an urgent need, because I had 2 failed prior surgeries with a different surgeon. And I actually found Dr. Lamm within the same week after the second surgery. So I woke up from anesthesia. I knew that this was not the result that we had discussed, or that I did not feel I would be able to recover from. So I went on a quest for the best, and it led me here to Dr. Lamm and Paley.
Okay, so when you got here with Dr. Lamm, how did he make you feel? Was it as what you thought it was going to be? Was it informational? Was he comforting?
Right off the bat for me, I felt so much better talking with Dr. Lamm because I could tell he was knowledgeable. I could tell that he was genuine in what he was saying.
So you're saying that was a little bit different than the other doctors perhaps that you had spoken to?
Yes, other doctors, when I started asking them questions, because I had researched brachymetatarsia, so no, I'm not a doctor or clinician, but I had some information and things I knew to be true. So when I was talking to certain doctors and I wasn't hearing certain things, it was concerning me, and I did not have those concerns when Dr. Lamm started explaining things to me. I could tell that he knew what he was talking about, and it made me feel comfortable. It made me feel like, okay, this is something that he's an expert in, and so I can really put my health in his hands and know that I am getting myself on a journey that I felt was going to have great results, and I was right.
Okay, and so for you, Heather, it was more of an urgent kind of a necessity, and so how did that come about with Dr. Lamm?
So I had completed my second surgery expecting the results that had been promised, and that didn't happen. And so I knew immediately that I needed to very quickly find someone who was not only skilled, but the best at what they did. Like, there was no other option for me. So I started researching and found Dr. Lamm, and actually my first interaction with him was by the phone. So I had emailed, and that's one of the things I think that makes Paley and his team so special, is they're so responsive to their patients. So I emailed and I just said, "This is my situation. I feel it's urgent. I work in healthcare myself, and I know it's urgent. When can you see me? Will you see me? What are your thoughts?" And he called me, I think it was a Friday evening over the Christmas holiday, and said, "I want to see you. When can you get here?"
And so how is it that you found him, though? There's a lot of doctors in the United States. How is it that you came upon him in particular?
So I think I started where most people would start. You go to your computer and you start Googling, right? The resources you have right there immediately in front of you. So I Googled, and I actually believe that Val's blog popped up, and I started doing some reading through her blog. Her results were amazing, but it was more than just the aesthetic. It was the whole journey that she shared with us, and that journey from beginning to end. And I just knew, I thought, okay, if he can produce these results, if he's got the bedside manner and the charisma that she's saying he does, then this is the doctor for me. And so once I had a name, then I could then do some further research. And as I started to research, I really felt like it was a sign that I needed to be here, because I thought, out of everyone in the world, how lucky am I that I live here in Florida. So I live about 4 hours away, and I'm seeing people from all over the world travel to Paley, and I can get in the car and be here, the next morning.
Right. That was my experience as well. I don't have brachymetatarsia, but we have one common denominator, and that's Dr. Lamm, and he definitely, that's how I felt too. I was super lucky to have a guy that took it upon himself to not just do the same old gold standard, which in my opinion could eventually change as science changes. What happens to that gold standard? We have to change that verbiage kind of. And so that's definitely how I found Dr. Lamm as well.
Yeah.
So in doing your research, how is it that you came upon Dr. Lamm?
So for me, the Facebook group. There's a Facebook group that is for people who have brachymetatarsia. It's a private group, so if you join it, you have to be accepted in. Okay. And that's just to make sure that, you're someone who really has the condition and not someone who just wants to troll, So in the group, when I was venting about how my other experiences with other doctors just was not going the way I wanted it to go, when I was doing the consultations, a lady named Jennifer mentioned Dr. Lamm, and when she gave me the name, kind of like what you said, Heather, when she gave me the name, I started researching, and I started seeing more and more people saying, oh, he did my surgery, he did a good job, and that kind of gave me the confidence to at least let me give him a call.
Right.
And once I talked to one of his staff members, and when I talked to the staff member already, just
They were awesome.
the
They were
vibe
awesome.
was so much better, so that made me confident to go ahead and get a consultation with him. And when I met him, just his bedside manner, just the time, the patience that he had, because as you can imagine at this point, I had a lot of questions because I had already interviewed a lot of different doctors, and I wasn't happy with what they said. So I had a lot of questions for Dr. Lamm, and he had answers, and not just answers, but good information to help me feel comfortable to move forward.
Sure. And for you, Heather, was it, having 2 failed surgeries before, were you a little nervous?
I was exceptionally nervous coming to the Paley Institute, not because I questioned their abilities, just at that point I was at the point of questioning, oh my gosh, what have I done to myself, and am I going to recover from this, and what, if I do recover, what's that going to look like? So when I first met Dr. Lamm, in person, and he walked into the exam room, I remember verbalizing, oh my gosh, I can't believe I've done this to myself. Like, I carried a lot of guilt with myself, I think because I'm a nurse, and I thought, you should have asked better questions. You should have done X, Y, and Z. Why didn't you? And for a very long time, I thought I could manage it on my own, like my recovery on my own, and just get through it and you'll be fine. But obviously that wasn't the case, and that's how I ended up here. So when he walked in, I remember saying, like, I can't believe I did this to myself. And he immediately, sat down in the chair next to me and said, you didn't do this to yourself, but we'll figure it out, and we'll see what's going on in there, and we'll get you taken care of.
Yeah, he definitely does make you feel comfortable that he's got this, he's going to look long and hard at it and help you figure it out together, for sure. That's because I was also one of those people that had 2 failed chilectomies. And coming to him was my last ditch effort to try and get out of pain. Was my problem. But so brachymetatarsia, I know there's some physical stuff that go along with it, but do people ever say, oh, you're vain, it's a vanity thing? Does that ever happen?
Absolutely. There's people who will say things like, it's just a toe, you can live with it, there's worse things. They try to make you feel badly about wanting to do something about it. Or they'll say, the pain is not debilitating, so you just deal with it. I don't think you have to live with pain at all.
So after you had it, how do you feel?
I feel great after the surgery. I don't have any pain, and then also I'm aesthetically pleased with how it looks.
Right.
And I don't think that makes me vain. I think we all have
Not
things that, that bothers us. And if something
Sure.
bothers you enough and it has made an emotional toll on you, I do so much more now because I don't have that added anxiety of, oh my gosh, what if somebody sees my
Sure,
feet?
it's self-conscious. I don't want
Yes,
nobody wants
very
to feel
much.
self-conscious about anything.
Yeah.
So, and that was the same for you?
Mine was more just about as I got older, my body's changing a little bit, things are starting to hurt and creak and ache a little. And so the pain just got to the point where on a day-to-day, I was okay. But if I exerted, if I went to the gym, especially on the treadmill, on an incline, that was becoming painful for me. And so it was more about the pain for me than anything. So, but back to the original question, I think, yes, what Val said, people, everybody has an opinion, right? But you have to do what's best for you, and only you know your body the best. So you have to make the best decision based on, your body.
And for those maybe that don't know much about it or haven't had it, brachymetatarsia, do you think that, like, are you having any kind of aftermath, any kind of problems after? Anything going on? Like, you were fixed completely, you're pleased with everything, no pain, none of that?
I'm extremely pleased. I think I think everyone's unique, and so I think that it's not realistic to think, especially in my situation where it had 2 failed prior surgeries, that there may not be maybe some aches or pains sometimes. It's not something that I experience often, but with any surgery, you're changing your body, and so that's a good question, I think, for anybody, and would be at the top of my list to discuss with my provider, like, what outcome can you get for my specific situation?
Right.
Yeah. So my expectations were met based on my specific, scenario.
Right.
Yes.
So Heather, tell me a little bit about the things that you were offered, perhaps with the first couple of doctors that you saw.
So when I did my research prior to having any surgical procedure, I already knew that I wanted the fixators. External fixators were the treatment option that I preferred. And so when I was interviewing other providers, those were the only options that I was willing to discuss.
But were you offered those options right off the bat?
I was not, because I didn't let them lead me down that path, that path of conversation. But I think if you've not done your research and you have not decided, what you think would be best for yourself, and had that honest conversation with someone, with another clinician, that they could very easily offer you it's called the one-step procedure.
And you wouldn't have known about any other procedures?
I would not have known that there were additional options, and everyone's unique, and everyone's cases are unique, and I'm not saying that may not be a good option for someone, but for me, based on what outcome I wanted and based on the research that I did, I was only willing to explore that one option.
And Valerie, was that the same for you?
So for me, initially, like as a child, when my parents took me to doctors for brachymetatarsia, the only options were foot orthotics, and there was even a doctor that said amputation.
Oh my gosh.
And amputation is something that doctors will tell you, especially back in the 90s, early 2000s.
In today's time, they'll tell you to amputate?
Now, most of the time, no, but I have heard of some doctors who still will, offer amputation, and I just don't. For me, that was just an absolute no. And my parents, of course, were like, no.
But did the other doctors, any of these doctors, offer you what Dr. Lamm was offering you?
So the other doctors that I spoke with talked about the one-step surgery. And also talked about the external fixation. Based off the research that I had done, I was like Heather, I felt more comfortable with the external fixation because it's gradual lengthening, and I think that really just allows your body time to gradually get adjusted to it versus the one step, them taking an implant, putting it in there.
It's one and done.
It's just kind of, I don't feel like your foot really, your skin stretches. I just don't think I didn't want it for myself. So for me, when doctors were talking about the one step, if you didn't even know if I qualified, because for me, I needed not a lot of length, but a significant amount. The more length you need, the one step really becomes less of an option. So I think for doctors who kind of push the one step, it's really not an option for everyone, because if you need a lot of length, you might do the one step and then need a revision surgery. I didn't want to have surgery and have another surgery and have another surgery. I felt like with the external fixator, I could have that. Yes, it's a longer process, but I felt like it would work better for me, and it did. I had one surgery, and that was it.
So I also had an external fixator, and for a different, slightly different problem. But that's a lot to swallow. The thought of that, I'm sure you looked at pictures of it, and so what did you think when it was offered to you, Val?
So the external fixator, I mean, it does look scary. Let's
Oh,
just
yeah.
be honest. I had 6 pins sticking out of both feet. I had brachymetatarsia on both feet, so I chose to get both feet done
Done
at the same time.
I did not know they did that.
So, that was something that Dr. Lamb discussed with me about I could have done it 1 foot at a
Sure.
time, but I was young and healthy, and he said, if you want to do both feet at the same time, you can. So I decided to go ahead and do that, and I'm glad that I did.
So how does that work? Can you walk around?
So with brachymetatarsia, the way that Dr. Lamb does the surgery, you can walk. Now, I'm not talking about getting up and walking around your neighborhood or going and walking around a store, but you are okay enough to walk around your house, get to the bathroom,
Okay.
go to your kitchen, things like that. So
And was it painful walking around?
It can be painful in the beginning because you've got swelling,
It's
you've got
healing
these,
a little bit,
it's
yeah.
healing. So, but gradually as you continue to walk, it gets better, it gets easier. They do prescribe medicines for you to help manage your pain. They tell you some great things about keeping your feet elevated, and they tell you how to manage. And so with the aftercare instructions, I never felt like, oh my goodness, there were days where of course I had more pain than others, but it never was just overwhelming because I was prepared. Dr. Lamb and his staff prepared me for what to expect.
And Heather, was that your experience?
Yeah, actually, my experience was just a little different because of that prior surgery, or the 2 prior surgeries. But I think it's important to share, the difference between maybe a surgeon who's not as qualified as Dr. Lamb versus Dr. Lamb, who's done multiple procedures. He knows what that aftercare looks like. He knows how to manage those complications. So actually, what happened in my case is that with those first 2 surgeries, I actually was not allowed to bear weight at all. So I had not walked in several months. I had a little pink knee scooter that had a little bell that my husband got me, and I went to work every day with this little pink knee scooter. It was like a second part of me. But as you can imagine, not walking for several months, I had muscle atrophy in my leg. So when I came to see Dr. Lamb, I'm thinking I'm going to need a 3rd surgery, and gosh, how long is it going to be before I can walk? I was so excited because I had been reading about cases like Val where she's having this done bilaterally and she's walking. So I was hopeful that that would be my case as well. So I had 10 pins in this 1 foot, and I was able to walk out of the hospital after surgery with Dr. Lamb when I had not walked, in several months.
That's awesome.
Yeah.
So Heather, tell me about, because if you live 4 hours away or even farther away, how is it that you're managing the post-op care with Dr. Lamb, and any questions you had related to the fixator that he just put in?
Right. I was concerned about that, and that was something that we spoke about with my initial consultation with Dr. Lamb, because I did know I had a complicated case, and I wanted to know, how are we going to manage this? I'd seen what complications could occur. I was wary of complications, and so he provided the most thorough aftercare. His team was responsive to emails. There were times that he would reach out to me personally if I sent him a picture and said, I don't know, it's making a weird noise. What is going on, right? Is this normal? It's jingling when I walk. So he would reach out, or one of his staff would immediately reach out, which is just amazing, and just speaks to the level of care that they provide.
Was that your experience as well, Val?
Yes, it definitely was. So I was a textbook case. I didn't really have any issues. But you've got 6 pins sticking out of each foot, and this is something that is new for you. So there were a couple times where I was like Heather, where I was like, is this right? Is it supposed to be doing that? Or I would send a picture, and Dr. Lamb, I remember even on a weekend, and I wasn't I didn't expect him to respond. I was thinking he'd get back to me during business hours. It was like a Saturday, and he responded, hey Val, this is okay. Everything looks good. That's normal. And doctors don't do that.
You don't expect
that. So he just, he really cares. He really cares. And sometimes that makes a big difference, especially when you're going through such a long process sometimes. I had my fixators on for 3 months. So, it's, some days you're kind of going stir crazy and you're thinking about everything that can be wrong.
Right.
And so to have a doctor that can really help you realize, like, it's okay, and not make you feel bad about contacting them.
My experience was the exact same. I could take a picture, shoot it by email, he'd write me back, and a couple times I had to call him. On a Sunday, I think I heard kids in the background.
Yeah.
Not a problem. So it's a good feeling to know that somebody's got your back when you're kind of on your own out there with this crazy fixator in your foot.
I had friends at one point over when he called one evening. I think it was a Saturday evening. It may have been like 9 or 10 o'clock at night. I was really concerned about, something. Was being a nervous Nelly, I'm certain of it. And he called, and I remember after we hung up, my friends commented like, geez, your doctor calls you on a Saturday night? I've never had a doctor call me. And it was like, oh, it's Dr. Lamm.
Exactly. So would you say that, all in all, if you had to do it again, would you do it again this way, the way you did it, minus the surgeries you had before?
Yeah, absolutely. I mean, Dr. Lamm would have been my first choice, knowing what I know now. I mean, I just would like to kick myself. I definitely would have started with him.
I don't think it's your fault if you're not given all of the information, all of the, ways that they could help you, and you can make your own choice, whatever choice that might be. I think that, that's truly where perhaps we get, wrong information or not enough information from different doctors that we go to. Just give me all of the options. Let me choose one of them for me, what's right for me, and I think that that's,
and I think it's important. I totally agree with that. I think it's important too. Like, I think the surgeon who did my first 2 surgeries, there was no malice. He just didn't have the expertise that someone who does these surgeries day in and day out and, has seen hundreds of cases, and knows how to manage those complications.
What sold me on Dr. Lamm, me personally, was I did have to do a little bit of research. I didn't come across a forum, and I wasn't able to speak to somebody that had been a patient of Dr. Lamb's. I actually went, I thought, let me see if there's any papers written on what I have and any other kind of alternatives that I can do. And so I went to PubMed, and I did have to go to the information was behind a paywall, and I went to Dr. Lamb's papers and read those, and they made sense to me. And I think that information should be given to the patients, should be readily available.
Yeah.
And it's tough sometimes to find, if a doctor's written any PubMed articles or written a book or anything. So did you find any of the research that Dr. Lamm, did you read any of his research?
Yes, I did read some research. Once I was looking for the best, pursued that like that was my job that day.
Right.
So I did, but I agree with you. It wasn't as easy to find. I think being in healthcare and being a nurse myself, maybe it may have come a little easier to me. I may have access to resources that the general public may not, but that's the point. The general public doesn't usually have access to those resources. So I agree with you. That's very, very important.
And that's one reason why on my blog I tried to be as detailed as I could and include a lot of information, but from a patient's perspective, so that people could feel informed. Because I feel like if I had known about Dr. Lamm first, I wouldn't have wasted money, because I do feel like I wasted my money
And time.
And getting my hopes up just for them to be dashed. I would have gone ahead and went with Dr. Lamm if I had known about him first. So that's why on my blog, I am fair, and I do list other doctors who perform the surgery. But of course, the only doctor that I can stand 10 toes on is about Dr. Lamm. And everybody knows that when they visit my blog.
Yeah.
So one other thing I wanted to ask you guys, how did you manage walking around and doing the things? Were you able to wear shoes?
So for me, I pretty much just wore my medical shoes that I was given by Dr. Lamm. I wore my medical shoes. I bedazzled mine because, they were just medical shoes.
They're not the most attractive looking thing.
I was given 2 pair, and so I bedazzled them and, tried to make them look cute.
I like it.
Technically, I could wear like a sandal, and I think I have a couple pictures on my blog where I've like put on a sandal. But because I wanted that support, whenever I was outside my house, of course, I just wore my medical shoe, my bedazzled medical shoes, and that's how I got around.
That's
you,
funny,
Heather?
Val, because I wore my medical shoes, same, but I didn't have the option of wearing a sandal. I think because my fixator had so many pins, you know, I was not given that option. And the thought of somebody bumping into it, or, you know, like you're saying, when you're outside of the home.
That's actually a good question. I used to get a lot. Weren't you afraid of kicking it or somebody bumping into it? Was that a big fear of yours?
I wasn't afraid that I would do something. I was afraid that somebody else, of course not intentionally,
Yeah.
but
Right.
somebody else may, knock into me. And we have had people in the Facebook group who have fallen and injured themselves and done damage.
Yes.
So it's something that, you know, whatever Dr. Lamm tells you to do for your aftercare, then that's the plan you need to follow. Not that these people were not doing that, but I'm
Right.
just saying, you know, try to protect your foot and your structure as much as possible.
And that brings me to infection. Did Dr. Lamm explain the whole infection?
Yes, so
Possibility.
that's something he went over very thoroughly about how to watch out for the signs of infection, what to look for, and then he preemptively wrote me a prescription for an antibiotic. So in the event that I noticed those symptoms, you know, I could contact him, but let's say that for whatever reason I didn't get them, which would be unusual, but he gave me the go ahead and take the antibiotic. That's why I
But you did not
prescribed
get
it.
them.
But I did not get an infection,
And Heather?
thankfully.
So I did get one.
Okay.
That was self-inflicted. I went back to work a little too early, I think, and I was so excited to be able to walk after not being able to walk so long that I overdid it the first day back at work, and I think that probably led to some swelling, which then led to an infection. But I had the same scenario. I had the antibiotic. I actually filled it because looking at my foot and seeing 10 pins, I was like, there's no way I'm not going to get an infection. And they're very common during
Yes,
the
they are.
procedure. And so, you know, even though you're very careful and like Val said, you get great instructions on how to wash, how to dry, you know, how to care for the pin sites. You know, it's par for the course sometimes. So I was prepared. Dr. Lamm had made sure I was prepared, had the antibiotic filled and ready, and, you know, developed no complications after that.
Oh,
Yeah.
good. So Val, can you just tell us how we can get to you online and all the information about brachymetatarsia?
Sure. So my blog is missmetatarsal.wordpress.com.
Super cute.
And so on that blog, you will find the information to find my Instagram account, which gives like a picture journey of my brachymetatarsia from pre-surgery, during surgery, after surgery. Also on there, you got all of Dr. Lamm's information about the Facebook group for those who want to join, and then it's just a detailed account of my journey from pre-surgery up until now. And I think that a lot of people who, you know, if you're a potential patient, if you're on the fence about Dr. Lamm, I think if you check it out, you really
good
will
information.
get the information that you will feel comfortable to make a decision to see Dr. Lamm. I don't know how you could read that information, and not to toot my own horn, but I don't know how you could read that information and see all the things and see the outcome and not want to go to Dr. Lamm.
Well, thank you for doing that, because I know they are a lot of work.
Yeah.
And thank you to Heather for
You're welcome.
sharing. And with that, we bid you adieu.